Welcome, everyone. Today we're diving into the intricate world of congenital heart defects, particularly focusing on coarctation of the aorta. Now, this condition is often linked with Turner's syndrome, a chromosomal disorder predominantly found in females. Throughout this presentation, we'll explore the crucial clinical features and diagnostic aspects of coarctation of the aorta within the framework of Turner's syndrome. So, let's delve into the complexities and nuances of this fascinating subject. Now, let's delve into the hypertensive component of coarctation of the aorta. One key indicator is notched ribbing. This occurs due to the increased collateral circulation that develops to compensate for the coarctation, leaving a distinct imprint on the ribs visible on chest X-rays. This notched appearance serves as a visual cue, signaling the hypertensive state in the upper body. Additionally, systolic murmur is often detectable upon auscultation of the back region. This murmur arises from turbulent blood flow through the narrowed aorta, further confirming the presence of hypertension. Furthermore, arterial hypertension manifests as elevated blood pressure in the upper extremities, while the lower extremities experience hypotension. This stark contrast in blood pressure distribution underscores the impact of coarctation on systemic circulation. Now, let's shift our focus to the hypotensive component of coarctation of the aorta. One prominent feature is the low femoral pulse. This occurs due to the narrowing of the aorta distal to the coarctation, resulting in a diminished femoral pulse. Another notable sign is the radiofemoral delay. Ordinarily, radial and femoral pulses should synchronize. However, in coarctation, there's a noticeable delay between these pulses, indicating an imbalance in blood flow distribution between the upper and lower body. Furthermore, claudication may present as a symptom due to decreased blood flow to the lower extremities. Patients may experience leg cramps and discomfort, highlighting the obstruction of arteries in this region. Now, let's explore the diagnostic considerations for coarctation of the aorta, particularly within the context of Turner's syndrome. First and foremost, physical examination plays a pivotal role. A meticulous assessment of the cardiovascular system is imperative to identify characteristic findings such as upper body hypertension and lower body hypotension. These clues provide crucial initial insights into the presence of coarctation. Moving on to imaging studies, modalities such as echocardiography, chest radiography, and CT-MRI angiography are indispensable. These imaging techniques allow for visualization of the anatomical details of the coarctation and aid in assessing the severity of the obstruction, guiding treatment decisions. Furthermore, a comprehensive evaluation is essential, especially in the context of Turner's syndrome. This involves a multifaceted approach including laboratory tests, genetic analysis, and evaluation of associated conditions. By adopting this comprehensive approach, healthcare providers can ensure holistic patient care, addressing not only the coarctation but also any potential comorbidities and genetic factors associated with Turner's syndrome. This comprehensive evaluation is crucial for optimizing patient outcomes and guiding appropriate management strategies. Let's now turn our attention to another significant finding often associated with Turner's syndrome, the bicuspid aortic valve. This congenital heart defect is characterized by the presence of two, rather than the usual three, valve leaflets within the aortic valve. Individuals with Turner's syndrome face an increased risk of developing complications related to the bicuspid aortic valve. These complications may include aortic stenosis, aortic regurgitation, and aortic aneurysm. The presence of a bicuspid aortic valve accentuates the importance of vigilant cardiovascular monitoring in this patient population. To mitigate potential risks, close monitoring is essential. Regular cardiovascular assessments, including echocardiographic evaluations, are crucial for the early detection and management of any emerging complications associated with the bicuspid aortic valve. By maintaining a proactive approach to monitoring, healthcare providers can intervene promptly, optimizing patient outcomes and ensuring the best possible care for individuals with Turner's syndrome. As we approach the management of Turner's syndrome with coarctation of the aorta, it's crucial to adopt a multidisciplinary approach. This entails bringing together specialists from various fields, including cardiology, genetics, endocrinology, and gynecology, to form a cohesive care team. This collaborative effort is essential for addressing the complex and diverse aspects of the condition comprehensively. Central to this approach is coordinated care. By ensuring seamless communication and collaboration among different specialties, healthcare providers can develop and implement a cohesive management plan tailored to the individual patient's needs. Recognizing that each patient is unique, individualized treatment is paramount. Tailoring the treatment plan to accommodate the patient's specific clinical characteristics and associated conditions is vital for providing comprehensive and optimal care. Moreover, patient education plays a pivotal role in empowering patients and their families. By providing thorough education about the condition, the importance of regular monitoring, and available treatment options, healthcare providers can promote understanding and adherence to the management plan, ultimately leading to improved outcomes. In summary, a multidisciplinary approach, individualized treatment, and patient education are essential pillars in the management of Turner's syndrome with coarctation of the aorta, ensuring holistic care and favorable patient outcomes. Let's delve into the surgical considerations regarding coarctation of the aorta in patients, particularly within the context of Turner's syndrome. Timing of surgical intervention is critical. Optimal timing typically occurs in early childhood. Early surgical intervention can help prevent the development of long-term complications and significantly improve overall cardiovascular health in affected individuals. Various surgical techniques may be employed to address coarctation and restore normal blood flow through the aorta. These techniques include end-to-end anastomosis, patch aortoplasty, or the utilization of a graft, depending on the severity and location of the coarctation. However, it's important to note that even after successful surgical repair, patients with Turner's syndrome and coarctation of the aorta require lifelong cardiovascular monitoring. Regular monitoring is crucial to detect and manage any potential complications or residual lesions that may arise post-surgery. In summary, timely surgical intervention, utilizing appropriate techniques, coupled with lifelong cardiovascular monitoring, are essential components in the management of coarctation of the aorta in patients with Turner's syndrome, ensuring optimal outcomes and long-term cardiac health. As we assess the prognosis and outcomes associated with coarctation of the aorta in patients with Turner's syndrome, several key factors come into play. First and foremost, early diagnosis is paramount. Prompt identification and management of coarctation of the aorta can significantly improve long-term outcomes and reduce the risk of associated complications. Timely intervention ensures that appropriate treatment strategies can be implemented, optimizing patient outcomes. Furthermore, surgical intervention plays a pivotal role in determining prognosis. Successful surgical repair of the coarctation, coupled with close follow-up and management of any residual or associated conditions, can lead to excellent long-term outcomes and a near normal life expectancy for affected individuals. This underscores the importance of timely and effective surgical management. Additionally, the significance of multidisciplinary care cannot be overstated. The coordinated efforts of a multidisciplinary team comprising cardiologists, geneticists, endocrinologists, and other specialists are crucial in ensuring comprehensive and effective management of Turner syndrome and its associated conditions. By working collaboratively, healthcare providers can address the diverse needs of patients, providing holistic care and optimizing long-term outcomes. In summary, early diagnosis, timely surgical intervention, and multidisciplinary care are key pillars in achieving favorable prognosis and outcomes for patients with Turner's syndrome and coarctation of the aorta. Through proactive management and coordinated efforts, we can strive to enhance the quality of life and overall health of affected individuals.